Hi everybody. Today we are going to say about another important topic and interesting fact or interesting test which we regularly check in for the any patient who drop into the emergency room or might be into the ICU. Or it can be a routine test as well. Yes, it is the capillary refilling test. So in this session, we'll be going and glimpsing on the capillary refilling test, what are the possible steps or the procedures for CRT, the common factors affecting capillary refilling test, and also we'll be glimpsing on the inference of how the capillary refilling test to be done. So in this picture, you can see that in the first picture, the normal refilling time of the blood when there is a pinch test is being taken. And on the other picture, you can see it is very much delayed and you can see the blanch test. That is blanching of skin or the paleness of the skin where the pinch has been taken and refilling is taking more than 2 seconds. So this test is primarily assessing or finding out the gross information of the quantity as well as the quality of blood flow. So what is the percentage and whether the percentage is perfused with O2 to the extremities. So this we call it as the capillary refilling test. So now we will be seeing on what are the possible factors that can affect the capillary refilling test. Might be you can see the patient is very normal, but you get an abnormal result or maybe it is delayed. So it will be varying according to the size, that is the age of the client. So for a neonate, it may take less than 5 seconds. For an infant, it is less than 2 seconds. For an adult and adolescent, 3 to 5 seconds. And for an elderly, it is less than 4 to 5 seconds. The other factors keeping in mind is that the environmental temperature. So if the patient is being exposed to a cold atmosphere, might be in an OT or in an ICU setups, where already the temperature is very low. So in those cases, there will be peripheral vasoconstriction. So which causes the refilling of the blood into the extremities very delayed. So you have to keep in mind whether the temperature is well maintained, normothermia. Then coming to the skin temperature. So the patient is already having hypothermia, rigor. In those cases, patient is going to have definitely an abnormal delayed capillary refilling time. And the quality of technique, whether you are going to have a good pressure, how much seconds you are going to give the pinch test, and how you are going to assess. So that also will have the direct impact or the bias on the capillary refilling time. So see that you always maintain a standard technique which is universally followed. And the place of pressure, so where which arm you have taken, whether the arm is already having any other perfusion imbalances. So check that and then you have to place the pressure. And of course, adequate lighting of the room. If there is very poor lighting, it is not very lit with light. So in those cases, might be the patient is having good refilling time, but we are not able to analyze a sense. And might be if the patient is already having any perfusion issues, or if the patient is having dehydration, such as there is the volume level in the body is already very less, or in case of edema, the patient's skin will be appearing shiny as well as silvery texture. So edema also you have to close check, and smoking. So whether the patient is a smoker or not. So all these factors put together in a nutshell will have its direct impact. So how we are going to do the capillary refilling time? Of course, we have to do perform the hand hygiene with AHT, or you can go in with soap and water, or might be the hospital policy. Then identify as well as greet the patient, explain the procedure and get the doctor's order before you do the test, and choose the digit without nail polish, jewelry or any wristwatch. Because if the patient is having nail polish, that can hinder the test, or you can have an abnormal report where you cannot see the refilling time in an appropriate time sequence. Or it might be if you're doing on a particular finger, ring finger. If the patient is having tight jewelry on that ring finger, that may constrict the blood flow, which can have a very delayed capillary refilling. Or if the patient is having a tight wristwatch. So if you are going to do in all the fingers where the patient is having a tight wristwatch, that will also have a direct impact on the capillary refilling time. So see that the digit must not be with any nail polish, jewelry or wristwatch. So that is very essential before you do the test, in order to keep the bias very less. Then place the patient's hand at, or it can be above the level of the heart, so that the perfusion of the return flow from the heart is very normal. And then you can check the nail bud for the color as well as before you start the assessment. Then press the nail for at least, keep in mind that you have to press it at least for 5 to 10 seconds and then slowly release it, not immediately releasing it. Observe the blood flow. So once the return flow is very fast or less than 2 seconds, that is a good sign of good capillary refilling time. Then all these must be recorded into the nurse's chart without fail. So from this test, what are the inference we get is that the normal capillary refilling time is usually 3 seconds or less, and a positive test is marked when it is very slow or absence of the blood flow into the area. So delayed capillary refilling time might be unilateral positive test, that is occlusion of an artery or arteriole. Bilateral positive test, that is possible systemic cardiovascular complications. Unilateral means either in one hand alone you are not having the return flow, the other hand is having good perfusion. Bilateral positive test is might be both the extremities, that is delayed in the capillary refilling time. So to summarize, this test is always performed, and you can see nowadays it is always recorded into the EWS chart, which we call it as the early warning score chart. So these are the possible assessment questionnaires on capillary refilling time, and I hope that you all will be able to answer it. The references which I have used for the capillary refilling test. And that's all for today. Thank you so much for your patient listening. Thank you all.